Hello, welcome to AMCI Saturday Study Session, or SSS. I'm Mrs. J, Curriculum Director here at AMCI, and I am delighted to present AMCI Lead Instructor Ms. Tamika along with her guest. Without further ado, let's get started. Take it away, Ms. Tamika.
Good morning. Good morning. How are my coders? All right. I know you guys are ready. I know you guys are ready. No, you don't, Miss Natalie. You're in the code matrix. Hey, that means that you are getting ready for that exam. That's what that means. That means that you are in the zone. If you're dreaming and thinking about codes that much, Miss Natalie, you are you are ready. You are ready. Good morning, Racha. Yeah, that's what it is. That means you're getting in the zone, Miss Natalie. It is a pleasure to have you guys here this morning. Hello to you as well again, Rasha. Hey, I know y'all are ready for some CPT coding. And I know that you love anesthesia. Those were one of my favorites. So hopefully it will be one of yours as well. This is a good one to pick up some time with and really gain some points if it speaks to you as well as radiology. Yes, I know y'all are ready. Y'all come ready, all right? So we gonna hop to it, all right? So you guys know I have to always lighten it up just a bit, with everything being somewhat locked down. Hey, every now and again you got to get creative with your hair and all that stuff. Things are limited, or at least you can't go as frequently as we used to. All right, but hey, that's okay. Who can see us, right? As long as we're clean and ready to code, that's all that matters. All right. So for our copyright, CPT copyright 2021, American Medical Association, all rights reserved. CPC is a registered trademark of the AAPC. AAPC content found within this presentation is copyright of AAPC. Keyword concept FTR Chun, AMCI, Fab 7, AMCI ICD 10, Flip, Tap are trademarks of AMCI. All right, and so you guys know what our agenda is. We've had the introduction. It is me today, guys. I am flying solo, so I should be able to keep up with you in the chat, okay? So if there's just a slight pause, you'll know why, but usually I'm pretty quick, so we should be good, all right? So you're still in good hands, all right? I don't have either of my wingmen today or my wing ladies, but that's okay. We're gonna make this thing work, all right? So we've done our copyright. Remember your steps for solving a time scenario and your keyword concepts. Have them on the appropriate pages and don't forget those facts to remember. Like I said, they really are like a compass and it really helps to settle your nerves if you approach it using that as your guideline. Okay, so it'll keep you centered. All right, we're gonna hop to these time scenarios. All right. It looks better than yours, Miss Nelly. Oh no, oh no. Like I said, no worries. We're not even gonna worry about it. If you're like me, I'm like, as long as it's clean, we're gonna keep rocking it, right? Hey, don't forget your feedback. I always love to hear from you, beautiful coders. We want to continue here at AMCI to deliver quality classes to you. It helps me to help you. No feedback means no good. It is always my sincere goal to help partner with you to get you to that certification. All right. And Ms. Natalie, we gotta help you stop dreaming about the codes, but I feel you on that. Good morning, Miss Susie. Hey, I'm always giving you guys some little tips for me, and only if this speaks to you. Another efficient way of page turning, if you're not already doing that, is to use the tip of the page. You'll notice you have code series up there. Now, if your mind doesn't work that way, then you do what is efficient for you. Don't go changing it, okay? Because right now you got to do whatever is working for you. But if this is something that you feel like, you know what, I could pick up on doing that really quickly, looking at the tab right up at the top and just quickly thumbing through that way, that does save time. You really want to naturally limit a full page turn if you can, or at least not too many. All right, we're going to get to it, y'all. I'm probably dating myself, but I loved Flintstones growing up. That was my show, the Flintstones. Okay, so we're ready to knock it out the park. Okay, we're ready to do some stuff. Good morning, Renata. We're going to start with anesthesia. I know that oftentimes it's a favorite for a lot of folks, and you guys know how we do it. After I read the answers and the scenario, I'm going to give you 2.5 minutes. I don't think it's going to take you long. So we're starting with A, 01962, B, 01963, C, 01969, and finally D, 01967. Report the appropriate anesthesia code for an obstetric patient who had a planned general anesthesia for cesarean hysterectomy. All right, you've got 2.5 minutes, coders, and your time, it begins now. All right, coders, how you doing? I think I have heard from everybody. If you hadn't gotten all of your answers in there, go ahead and slide it in there. That is okay. That's okay, Miss Susie. Hey, it's enough mamas around here. We understand. We do understand. All right, I think I have heard from everybody, so I am gonna go ahead and unpack this thing. Okay, so we can keep it moving because we got some meatier things, some meatier fish to fry this morning. Okay, all right, so here we go. That's all right. I got you. I got you. Miss Renata, I got you. Okay, coders, let's do this thing. All right, your answer is B, and I'm going to show you guys how we got there. All right, so most of you got there, and then some of you were just right at it. And this is one that you're going to remember. Trust me. All right, so our key parts are anesthesia, obstetric, planned general anesthesia for this cesarean hysterectomy. All right. So the nice thing about this, these codes are obviously close together. You can see that. Start taking note of that too when you're looking. These first three characters are the same. And so, that's probably in the same neighborhood. So we're going to cue in on these two: planned cesarean hysterectomy. Those are pivotal in this case. 01962, this is anesthesia for urgent hysterectomy following delivery. Number one, it was planned, so we know it wasn't urgent, and this is saying following delivery. So that's wrong twice over, all right? We're going to keep on going, and we take a look at 01963, anesthesia for cesarean hysterectomy without any labor. Analgesia anesthesia care without any labor. All right, that's a game changer. You might want to put a little note there: no labor, because it was planned. Okay. All right. And so we're going to give that a like. Yes, we've got to do our due diligence. We already know that for C, and nobody took the bait on that one. That is an add-on code. It wouldn't stand alone, so we aren't even going to read it. Okay, that's just how I want you to do when you're on the exam. If they're trying to pull a fast one on you and put that add-on code first, don't even read it. Once you see the plus sign, exit off. All right. So then we're going to take a look at 01967, neuroaxial labor analgesia anesthesia for planned vaginal. All right. We know that's no good either. All right. Because again, talking about a vaginal delivery. So that's our choice, 01963. And let me show you, even if this was still kind of stumping you without any labor, that can kind of like, I'm not sure. Well, you could have deduced it by looking at this. This is following delivery. We know that they didn't deliver, that they had a hysterectomy, a cesarean hysterectomy. Okay, so they delivered, but they delivered via his cesarean section. Okay, so we know that that can't be it, because they're having a cesarean, so they're not delivering. All right, so we could take that off. We know that they're not doing anything vaginally there, and then that's an add-on code. So that's another way you could backdoor it if that was not speaking to you, but notate it right there if you hadn't, so you won't miss it going forward. All right, we're going to pick up the pace a bit. All right, so we have A, P1, B, P2, C, P3, D, P4. What physical status modifier best describes a patient who has a severe systemic disease that is a constant threat to life? Now, I'm just going to mute myself for about 30 seconds. This is a matter of knowing where to look in that book. And I see Rasha is already in there. And yeah, you are spot on. All right, coders, I'm looking. All right, there we go. I see what I wanted to. I had to give just some of you just a light nudge, and it really wasn't a nudge. It was just take one more peek, okay? I know you're reading so fast. You're just like, oh man, I missed that little piece. Hey, we're not even going to spend much time in this. You know where to look for with these physical modifiers and what you're looking for when you read them. All right, so really we're just going down. We're looking specifically for severe constant threat, okay? P1, we know they're normal. P2, they have just mild systemic disease. P3, they have severe systemic disease, but for P4, they have severe systemic disease with a constant threat to life. All right, so this was just a matter of just going down and checking it out. That is okay. All right. I see you in there so much. Hey, a couple of you guys were like going between P3 and P4, and I know why. You saw severe systemic disease, but don't forget constant threat to life. Okay. So I throw those in there. I want to be sure you guys can pinpoint what you need in the book, but I also want you guys don't go so fast that you miss these little pieces that help you to be forensic. Okay, so no worries. I knew you guys knew where to look. It was a matter of just slowing down and finding it. Also, take note of the fact when you're reading scenarios and if you need to pull out a physical status modifier, notice that they're going in chronological order. As the numbers increase, then the condition of the patient gets more severe. Okay. All righty. Yep. That's it. Just had to read. That's right, Miss Renata. All right. We're going to keep it moving. All right. So we have A, 7:14 a.m. to 8:18 a.m. for 64 minutes. B, 7:14 a.m. to 8:29 a.m. for 75 minutes. C, 7:26 a.m. to 8:18 a.m. for 52 minutes. D, 7:26 a.m. to 8:29 a.m. for 63 minutes. Anesthesia start time is reported as 7:15 a.m. and the surgery team began at 7:26 a.m. The surgery finished at 8:18 a.m. and the patient was turned over to PACU at 8:29 a.m., which was reported as the ending anesthesia time. What is the anesthesia time reported? I'm giving you guys 2.5 minutes, and I already got one answer already in there. All right, coders, you got it. All right, I've got some great coders in here, and you are right, Rasha. You guys are, you know what? Not only are you going to be coders soon, you're coders now. You're going to be certified coders real soon, okay? And it shows. I see you guys doing some dynamite stuff in there. And I think I've heard from everybody. If someone is still working, go ahead and slide your answer in the chat, okay? We're going to keep it going. Here we go. You guys all got there, so I'm not going to spend much time on it. I'm just going to breeze through it. You guys understand what you are looking for. We're looking for the start time and the ending time for the anesthesia, or when that patient was turned over to PACU. And while the surgery began at 7:26 a.m., and that's good information, and it finished at 8:18, good information to know, but not what we need specifically here. And so that is the takeaway, and you guys already understand what those two key points are for reporting time when you are doing anesthesia time. So I'm just going to swiftly go through our start time here, and it tells us it's 7:14 a.m. and we have that in A and B. 7:26 a.m. That's simply when the surgery started. And yeah, good information to know, but not specifically what we need here. And then the patient was turned over to PACU at 8:29 a.m. And you guys picked up on there. And there it is right there, 8:29 a.m. Really, you could just do it just like that and have it before you even start calculating. All right. So this case, we could solve it just like that. But hey, we're gonna do our due diligence. 7:14 to 8:14 a.m. is 1 hour, and then 8:15 to 8:29 is an additional 15 minutes, giving us 75 minutes. And then we count off the units of time for 5. All right. But we didn't even have to go converting and doing all that. They just wanted the minutes, and you guys were spot on. So we're going to keep moving. All right. So you guys already know every 15 minutes again is 1 unit of time. Okay. So for this one, we're going to have to put that particular concept to the test. 15 minutes of time is 1 unit. Okay. So we have A, 1200, B, 1000, C, 1100, D, 900. Code 00731, anesthesia for upper gastrointestinal endoscopic procedures. Endoscope introduced proximal to the duodenum, not otherwise specified, has a base unit of 5. The patient is a P3 status, which allows one extra base unit. Anesthesia start time is 7:37 a.m. and the procedure started at 7:50 a.m. It finished at 8:15 a.m. and the patient was turned over to the PACU at 8:52 a.m. Using 15-minute increments and a conversion factor of 100, what is the correct anesthesia charge? All right, coders, I'm going to give you 2.5 minutes and your time. It begins now. All right, coders, we are about to unpack this thing. I think I have heard from everybody. All right, so I think we're ready. And I see some good keywords in there from some of you. And you know what? It was a little bit of a split, and some of you were going a little back and forth. All right, so no worries. I had some people thinking I think it's B. It might be A. Not sure. That's okay. All right, so we're gonna do this. Yeah, we gotta get this time unit down. That's right, Soma. That is always the key. All right, so our answer is C for 1100. And that typically is where you start going around and missing it a little bit if you're just off just a bit with the time. So this is our code is 00731 for the anesthesia for the upper gastrointestinal, but we're focusing on the fact that we also have a base unit of 5 that's going to be given. The patient is a P3 status. That's allowing 1 extra base unit as well. Yeah, I got you, Renata. The anesthesia start time is 7:37 a.m. and the procedure started at 7:50 a.m. It finished at 8:35 a.m., but the patient was turned over to PACU at 8:52 a.m. And the reason I read these other things is because these things can sometimes get in your way. What you're focusing on, like you did on the last one, is when did anesthesia start? Started at 7:37. When were they turned over to PACU? That's at 8:52. That's when it officially ends, is when anesthesia care is no longer being given and they've been turned over to PACU. All right. And then we're going to use these 15-minute time increments, and they've given us a conversion factor of 100. So here's our formula. You guys know that formula, so we're just going to plug these things in. The base is 5. We're going to come back and calculate this time. What are our modifying factors? Okay, so we've got 1 for this extra base unit, all right there. Okay, and then we've got our anesthesia start time of 7:37. End time for the surgery would be 8:52. So we need to subtract these, the end time minus our start time for our anesthesia time. Okay, the total time. 8:52 minus 7:37 gives us an hour and 15 minutes. All right, now we need to convert this to our anesthesia time. Okay, remember I told you for every 15 minutes, that's 1. So we've got 1, 2, 3, 4 for that first hour, 7:37 to 8:37. Now an additional 15 minutes from 8:37 to 8:52 a.m. 8:52, yeah, 8:52 a.m. Now, that gives us a base unit of 5 because now we have to count those off. 1, 2, 3, 4, 5. That goes there. We add these things together. 5, 5, and 1. That gives us 11. Then we take the conversion factor, which is 100. Once we multiply that, that gives us 1100. Okay? So typically the sticking point is usually sometimes the modifying factor if you didn't pop that in there. Okay, and then you add all these up. After you get that, you're going to use that conversion factor to multiply it, and that gives you the sum total. Yeah, good, Renata. I'm glad. All right, so I think, how are the rest of you guys doing? Okay, so I had a few of you that were just kind of skirting around it, and I figured it was probably the base units and then taking it and plugging it back in right there. Okay, we got to take one more step on that thing. All right, so we're going to keep going. You guys are doing terrific. All right, so that's how we got to C. Okay, all right, here's our next one. And for those of you who weren't at the very beginning, like I told your fellow coders, okay? Because like I said, you guys are coders. It's just me today, so I'm reading and doing the chat. So if I'm a little slow, I think I should be able to keep up. So no worries. All right, I got you. So here we go. That's why I'm reading too. All right. Yes, I've got some more. I sure do, Renata. I told you I always keep a lot of junk in the trunk, y'all. I got just a one. I got one more anesthesia code for you in there. I know I can pull up. All right, so here we go. A01952 with a P5 modifier, 01953 with a P5 modifier times 5, 99140. B, 01952 with a P5 modifier, and 01953 with a P5 modifier. We have C, 01951, 01952, and 01953 times 4. And finally, D, 01951, 01952, 01953 times 4, and 99140 with a 51 modifier. A patient with third-degree burns over 54% of his body is being treated under anesthesia for excision, debridement, and extensive skin grafting. The patient's condition is listed as severe, and he's not expected to survive without the operation. The operation is further complicated by the emergency condition of the patient, and delaying this procedure could lead to loss of body parts. How should the anesthesiologist report his or her services for this procedure? All right, coders, 2.5 minutes, and your time starts now. Just take a breath and code. How we doing, coders? I think I've heard from all of you. I might be missing one or two of you, and I don't want to start talking about it until I have heard from everybody. Let me count in here. I think I'm missing maybe one or two. There we go. I think I've gotten everybody now. If you hadn't got it in there, go ahead and slide that answer in there. I want to hear from all of you, and that will help me to know if I need to tailor my answer just a bit to maybe drive some points home, but I think that all of you have gotten it. Yeah. I see y'all, man. Oh man, I'm loving this. I am loving this. Y'all gonna bring me to tears. Y'all gonna bring me to tears this morning. All right, so here we go. Everybody got there. Yeah, the answer is A. All right, so we already know, hey, we've just got to make the decision between two lead codes before we get going. So one way to solve this, all right, is you could take a look at the third-degree burns, and that the patient's condition is severe, the emergent condition of it. Yeah, that's right, Soma. Yeah, hone in on that P5. Okay, so once you do that, we already know we're going to use this for the burns, but specifically not this code. We need the common code language, which you guys obviously knew that, but not less than 4% of the body surface area. They have third-degree burns over 54% of their body. So already we're down to half. All right. Now, once you get there, what's something that you know you need? And yeah, that's right. Soma, C and D already eliminated, and you already could cue in on the fact that because it was emergent, they needed the P5. So we need to take here, we already know we're going to need the 01952 because this is 4 to 9%. We need the add-on code with the additional 9. All right, and it's telling us we're in the right spot. Use these two together. You guys knew what to do. Take the first 9, and for everything left over, we need to get a multiplier in there. All right, so we know it's going to be 6. So we used one of them. All right, and we had 5 left over. That's how we got there. So knowing that we need that multiplier, that takes that out. As soon as you see each additional, that's another way you could take that one away, and you're right here. Okay, that's right, that 54% of the body. Another way, all right, you could do it a second way. You know, I love to show you that, and Soma zeroed in on that. Yeah, once you see that they were severe, not expected to survive, you can get rid of these two that way because they didn't have the P5 modifier. And then once you took another way you could also do it, once you do that, you're also going to need, with the qualifying circumstance, okay, look down here. Emergency condition. Delaying the procedure could lead to loss of body parts. Look at there. We're going to need that add-on code of 99140. Emergency defined as existing when emergency is defined as existing when delay in treatment of the patient would lead to what? Significant increase in the threat to life or body part. So that's another way you could get there as well. Okay, so you know I always like to give you guys a few ways of looking at it, but sometimes it's a matter of, again, back to those doggone modifiers. Okay, they can serve as a catalyst, if you will, to speed you to an answer or at least get you 50-50 so you continue to move through. All right, we're going to keep on hopping. You guys are doing terrific. The qualifying circumstance section, Sharnita, should be on the same page as your physical modifiers. Okay, the physical status modifiers, look right across from there, and you'll see those qualifying circumstance add-on codes. Okay. All right, so here we go. We have A00320, B00326, 00320, 99100, D00326, and 99100. A 9-month-old child is taken to the operating room for removal of a laryngeal mass. What is the appropriate anesthesia code? All right, coders, 2.5 minutes. I think you could probably do it in 2, but your time, it starts now. All right, coders, I see y'all in there. Hey, I had a few of you took the bait and had to remember those parenthetical guidelines, and I love that you guys caught it and made the correction. Yeah, those parenthetical guidelines, they rule. And I know you guys will agree. You guys are showing some strength with the coding. No worries. I always tell you, we're just fine tuning it. I know you guys have the concepts down. I'm just trying to get you a little bit quicker, a little bit more efficient, and to be sure that you're catching certain things that might trip you up. Okay. Yeah. Just take a closer look. That's right, Renata. Yeah. Just a closer look. Okay. So, can you guys hear me? I think. Let me see. Okay, so you can let me just quickly let Miss Sharnita to mute, tell her to mute and unmute herself. Give me. All right, I am back. Okay. All right, so now you got the sound, Miss Sharnita. All right, I was sending you a text. I thought, okay, if somebody tells me they don't have sound, I gotta text them. They can't hear me. I gotta chat them. All right, so you guys got here at B with just a little nudge for some of you that needed to just kind of like take a second look. So I'm not gonna spend much time. We have this 9-month-old. They're having removal of this laryngeal mass. We go up here to code 00320. This is for age 1 year or older, or already this is a 9-month-old child. So we're going to take that one off. Already we're at 50%. That gets rid of A and C. We go down here to 00326. This is younger than 1 year. We know we're in the right space because this is telling us anesthesia for procedures on the larynx and the trachea in children. But the sticking point, okay, was whether or not we needed that 99100, and it's telling us right there, do not report this 00326, specifically this code in conjunction with that one. That's why we get to B. Yeah. And even when we go over and we try to use it, it tells us again for a procedure performed on infants younger than 1 year of age at any time of surgery, it tells us to see this code. And when we do, boom, it gets us back here and tells us again, don't use me. I told you, don't use me. All right. So there we go. All right, guys. So we're going to keep it moving. You guys were right there. It was all about the parenthetical guidelines. All right. So here we go. We have A00834 with a P2 modifier, 99100, B00832 with a P2 modifier, and 99100, C49560, 00834, 91000 with a P2 modifier, and finally D00832. Okay, an anesthesiologist provides general anesthesia for a 72-year-old patient with mild systemic disease who is undergoing a ventral hernia repair. How would you report the anesthesia service? All right, coders, 2.5 minutes and your time. It starts now. I'm looking for some good stuff. You guys are on fire. Here we go. All right, coders, you all got there and didn't even need all of the time. That's what I'm talking about. Hey, we're gonna go ahead and unpack this thing because you guys already knew what to do. I have some beautiful keywords in there. I see you in there, Miss Natalie and Renata and Rasha, you guys have great keywords in there as well. I see Soma in there. You guys were spot on. So again, I'm not going to spend a whole lot of time. I got to keep moving because I got some more that's got a little bit more bite. All right, let me see what you got, coders. You guys are showing out today. Here we go. How could you eliminate two of these answers on site? And I'm thinking that maybe you did. All right. We've got that anesthesiologist. This is a 72-year-old patient. That's right, Soma. We're going to go ahead with just that little bit of information. Okay. 72 years old, mild systemic disease. We're going to head on over there and take a look at those qualifying circumstances, add-on codes, as well as the physical status modifiers. Look at there. We're going to get rid of that one. We're going to get rid of that one there and this one because we don't use surgery codes when we report anesthesiologist services. Yeah, that's right. All right. Susie was right on it. Sonia, yeah, you guys are right on it. That's right, Natalie. So we're down to just those two up top. All right, that was just a matter of taking a look specifically at the different codes. And here, this is a 72-year-old patient. And when we take a look at 00834, this is for a patient younger than 1 year of age. All right. And so we know that that's no good. And it's telling us also we would not report this in conjunction with 99100 anyway. All right, so we take that one off, and yeah, this is it right there. Anesthesia for hernia repairs in the lower abdomen. We knew that's where we needed to be. There we go. Ventral hernia down to here. Yep, grab that common code language, and specifically this dependent that got us there. And then you guys already knew about the modifiers physical status modifiers and about that add-on code because of the patient's age. So yeah, that's right. That's right. You guys were all over this thing. So I'm going to keep it moving. All right. So here we go with the next one, guys. We have A019260 with a P2 modifier, 99100, B01272 with a P3 modifier, 01272 with a P2 modifier, 99100, D01270 with a P3 modifier, and finally 99100. We have Mr. Johnson, who's age 82, having been in poor health with diabetes and associated peripheral neuropathy, is having a FEMPOP bypass. The anesthesiologist documents he has severe systemic disease. What code or code is or are correct for the anesthesia? All right, coders, you guys have been showing out today. I can't wait to see what you put in that chat. All right, your time begins. All right. I think I've heard from all you coders. Yeah, I see some beautiful keywords in there. I see in there Sonia Renata. I've got Rasha in there. You guys are on fire. Susie, I see you guys in there. I see you too in there, Miss Natalie. I mean, like, you guys are just dynamite today. Really, really are. I'm loving what I see. So, again, you guys are spot on. Y'all are ready to test. Okay. So, yeah, the answer is D. You guys already knew how we got there. Yeah, you honed in on these physical status modifiers as well as these particular qualifying circumstance add-on codes. All right. So how could we solve this one on site? Yeah, that P3 modifier. A couple of you were checking. That is severe systemic disease, right? See, now you know why I gave you that little baby one. I wanted to be sure you're clear on that. All right. So knowing that severe systemic disease is P3 status, we could eliminate those two right off the bat. And y'all know I'm always couponing. I'm always needing two for one. All right. So there we go. We're down to B and D already. Well, no qualifying circumstance modifier was in B. Look at that. Boom. We're already in D. All right, but you know I'm gonna take you through the code language, okay? I don't think you need it. You got there, but I'm gonna show you specifically 01260. Pop bypass is bypass of femoral popliteal arteries in the upper leg. This is coding for veins of the upper leg. So that's why you would specifically eliminate code 01260. Okay, it's coding for veins, not arteries. 01270, anesthesia for procedures involving arteries of the upper leg, including bypass graft. Yeah, we're going to give that a light yes. We're going to take a look here. 01272. This is coding for femoral artery ligation. Yeah, that didn't happen. That's that ligation. We're looking for a bypass. Well, already, because of the wrong procedure, we're done with that. Okay. And so 01270, yeah, that's it. So this was a matter of being comfortable with the fact that when you see this, that this is coding for veins, but understanding that that fem pop bypass is for arteries. Okay. Another way you could have done it if you weren't clear that this is indeed coding for arteries and you see the veins, you see the upper leg, look at this. You have more keywords in 01270 as well, including bypass graft. Okay, so definitely let those keywords work for you. All right, as well as these modifiers and these qualifying circumstance add-on codes. Okay, and I think Miss Sharnita was asking me earlier, and you may have already found it about where to find those at. They're on page 73 of your 2021 CPT manual. All right. Okay, guys, we're gonna keep it moving. All right. So yeah, I gotta do my due diligence, showing you again where we got that from, the physical status modifier, as well as that add-on with the qualifying circumstance. Okay. All right. Now we're moving on. Yeah, I showed you how to solve it. That was the incorrect modifier. That was the incorrect modifier. Qualifying circumstance not listed. All right. Okay, I told y'all we would get one more. All right, we're going to round out anesthesia with this final one to calculate the anesthesia charge. All right, A, 800, B, 900, C, 1000, and D, 1200. Code 00940, anesthesia for vaginal procedures, has a base value of 3 units. The patient was admitted under emergency circumstances, qualifying circumstance code 99140, which allows 2 extra base units. A pre-anesthesia assessment was performed and signed at 2 a.m. Anesthesia start time is reported as 2:21 a.m. and the surgery began at 12:28 a.m. The surgery finished at 3:25 a.m. and the patient was turned over to PACU at 3:36 a.m., which was reported as the ending anesthesia time. Using 12-minute time increments and a conversion factor of 100, what is the correct anesthesia charge? All right, terrific coders, you've got 2.5 minutes and your time, it begins now. All right, make me proud. I know you're going to do something great. All right, that's our time, and you guys were spot on. All right, and if you needed a nudge, once I gave it to you, you got there. So this is right where I want you to be. I know many of you are getting ready to test, and so I'm so excited to see just what you guys are doing today. I love it. Okay, so the answer is C, and again, I'm not going to spend much time because y'all got that thing. All right, I think you are going to get anything related to anesthesia correct on that exam. Okay, I see y'all. I see y'all. Yeah, we've got that base value of 3, and we have these emergency circumstances, qualifying circumstance code 99140, and that's allowing us 2 extra base units. We've got that anesthesia start time as 2:21, and the surgery began at 2:28. Yeah, that's good information to know, but this is what we want, and you were on it. We need the start time and when they were turned over to PACU, 3:36 a.m., which is simply the ending anesthesia time, and that conversion factor of 100. So we're going to use that formula again. Hey, you know what? I'm gonna always hype y'all up, Miss Natalie. And like I was telling Rasha, I want you guys to go in there and be confident. If you need to write some affirmations on certain pages of your book, do that. I'm gonna tell you what I would do. Even I'm studying for yet another certification exam, and I will write my name sometime on my paper when I'm studying and put the certification after. That's what I want y'all to do. Put the CPCA after your name. You got to see that thing, y'all. All right, okay, I digress. I digress. All right, so we've got our base at 3. We pull it out there. All right, and then our time. Okay, we're going to come back for that. Go ahead and plug in that modifying factor. We've got the 2. All right, so we're going to pop that there. And then we've got that conversion factor of 100. All right, so let's grab this time though. The end time, 3:36. Okay, and then we've got the start time. All right, so 3:36 minus 2:21 gives us an hour and 15. All right, that's right, Renata. So we're going to go ahead and break it down. Yeah, 4 units per hour, 5 units total. And we know that every 15 minutes, when we make our pie, every 15 minutes is a unit. Okay, so that's 15, that's 15, that's 15, that's 15. All right, so we're going to count them. That's 1, that's 2, that's 3, that's 4, that's 5. All right, so we're going to plug that in. So we do 3 plus 5. That's 8 plus 2, 10 times 100. That's how we get to that 1,000. That's indeed how we ended up at C. Okay. Yeah. All right, coders, you guys were there. I also want you to know probably anything you see, they're going to have it in even increments of 15. But just know if you ever had anything that was an hour and 16 minutes, then you would need the next unit of time. Okay. So I'm just putting that out there. Okay. It's kind of like when you see codes or part thereof. So every increment of 1 minute to 15 is a unit. If you have anything left over, you would have to code for yet an additional unit. Does that make sense? Let me see some guidance or yes. Okay. So I just wanted to point that out. Okay. So good, Renata. You wanted to know yes. So just in case, most likely they will round it out to 15-minute increments. But like I said, if you have anything left over, you got like 2-3 minutes hanging in it, then you got to use another unit to account for any leftovers. Okay. All right. So now we're going to head on here. I think we got one more. Yeah, we got this little quick one. We have A00210, B61312, C00211, and D61314. A patient presents to the OR for a craniotomy with evacuation of a hematoma. What CPT code is reported for the anesthesiologist's services? All right, so I'm not going to speak too much, but remember who you are coding for. All right. I've said too much. All right, guys. Your time starts now. You've got 2.5 minutes. All right, y'all. Didn't need all that time. Hey, I was able to look at that chat. I'm like, they are bringing the heat. They are serious this morning. All right, so I see some great keywords in there, and you guys are spot on. All right, so yeah, our answer is C. So we're gonna whiz on through this. They were in the OR for this craniotomy for evacuation of a hematoma. We're coding for the anesthesiologist services, and yeah. Hone in on the fact that whenever you are reporting something for an anesthesiologist, you've got to use anesthesia codes, not surgery codes. So already, I love a good coupon. Look, y'all know I love a good coupon. I want y'all to hear me saying that on the exam every time you're able to take away some codes real quick. All right. So we've got anesthesia 00210, anesthesia for intracranial procedures. Oh, I like that. But that right there, that won't do, not otherwise specified. We know what we're coding for. We got that hematoma going on. So right code, family. That common language is good, and you guys picked right up on it. Craniotomy or craniectomy for evacuation of hematoma. I mean, like, this is verbatim. I love it when they do that. All right, that's an easy way to pick up some points. There we go. 00211. So hey, we are ready. Oh, thank you so much, Rasha, and you too, Miss Natalie. All right, y'all. We gotta change gears, okay? We got some more stuff. Oh man, you know what? We're gonna hold this one, okay? So give me a sec. Let me go to the next thing because I want to go ahead and jump into some radiology. So if for some reason we need to code some more, let me get through these because I like to get through some meaty things for you, okay? So I want you to remember when you are with radiology and stuff, remember what the global charge means. The provider owns the equipment, he employs the staff, and so the provider is entitled to the full payment. Now, if they are coding, if you're coding for the professional component, which is modifier 26, this is simply, it'll say interpretation. This is requiring the physician's professional expertise, meaning they might be reading an x-ray at the hospital, but they're not employed by the hospital. So you would put the 26 modifier because we've got to pay this physician, but they are not an employee of the hospital. So we would add the 26. If it's a technical component, this is the cost of the equipment and the salary of the technician. So if the technician is there doing what they do and they're not an employee of that facility, then we need modifier TC for technical component, okay? But whenever you see that global charge, meaning like if a person is an employee of the hospital and they just tell you that the radiologist did blah, 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 if they don't say they're not employed by the hospital, then you make the assumption that they are, okay? That makes sense. All right, so I'm gonna barely mute myself. Which plane divides the body into the anterior and posterior halves? Yeah, I've got some answers coming in there. I like what I'm seeing. I see Natalie and Rasha in there. You guys give me what you're thinking. Yeah, there we go. Coronal. Yeah. So just remember, and you have different pictures in your book. All right, so you've got the coronal plane, anterior and posterior. The sagittal plane is going straight down the middle into equal halves. In fact, right and left, and the transverse plane is dividing the body into upper and lower halves. Okay, so I always like to keep you guys situated because sometimes just the little things, that base will come back. Which anatomic position has the patient lying at an angle instead of lying flat or directly on their side? All right. So you guys can pop it in the chat for me. Again, we're just getting these foundational things situated. I want to be sure my coders are spot on. I plan to see CPCA after some names, all of your names. All right. Yeah, there we go. D for oblique. All right. So we've got right lateral recumbent lying down. They're on the right side and then they're on the left. Okay. Supine. Okay. A way to remember that. One of our instructors would say, think of looking up, and prone with the O, think of looking down. All right. And then anterior oblique there. Okay. All right. All right, so now we're going to jump on into this. We have A 70554, B 70555, C 70551, and finally D 70552. A patient reports to the hospital radiology department for a functional MRI of the brain. The technologist asks the patient to perform small tasks. He takes the images of the patient at rest and while performing the task. What CPT code is reported? All right, my soon to be certified coders, go ahead, start coding. Got 2.5 minutes. All right, y'all are doing it. Y'all are doing it. Y'all are showing out. Y'all better duck for cover. Y'all are making it rain in that chat. Y'all are making it rain in that chat. Yeah, I'll see y'all, or y'all might be getting wet from my tears. Tears of joy. I am just so excited for you coders. Yeah, we're gonna go ahead and unpack it real quick. We got some more stuff in the trunk. Hospital radiology department for functional MRI of the brain. This is a technologist that's taking these images with the patient at rest and they are performing tasks. All right, so answer A. Here we go. We have 70551. This is for just a regular MRI, magnetic resonance imaging of the brain. Okay, well, we are not just doing an MRI, we're doing a functional MRI. So 70551, that's off the table. And what do we always say? If the common code language, meaning everything before the semicolon, if that's incorrect, and you have some dependent codes that fall up under there, hey, that's a bonus. We know they're going to be wrong too because that common code language is incorrect. Boom, we're already at 50%. Yeah, that's right, Nelly. Then it's wrong. Yeah, there we go. Couponing again, y'all. We can move on over here to our next code family. So this one, functional MRI. We know we're in the right place, okay? And this is letting us know also when the test is administered by a technologist or other non-physician or non-psychologist, use 70554. Look here, already they're giving us the answer, okay? Yeah, look at that. But we're going to go ahead because we know it's a technologist. We're going to read these codes. Magnetic resonance imaging brain functional MRI. That's the sticking point. That it is a functional MRI. Okay. Not requiring the physician or psychologist administration. Okay. Yeah, that's our code. We don't report this in conjunction with that. That didn't apply. We're going to give it a light yes. We're going to do our due diligence and look at this dependent code. But this is for this is requiring a physician or a psychologist, and no, this was a technologist who did this, and you guys got that. Yeah, hey, we're gonna keep moving. Yeah, so you guys continue to just keep this pace going. All right, so here we go. We've got A 72084, B 72040, 72070, and 72100, C 72082, and finally D 72083. A patient needing scoliosis measurements is coming in to have standing anteroposterior and lateral views of his entire thoracic and lumbar spine. What CPT code or codes is or are reported for radiology? All right, coders, your time is going to begin now. Keep doing what you're doing. It's terrific. All right, coders, how you doing in there? I think I have gotten answers from most all of you. I think so. Yeah, yeah. I'm loving it, loving it, loving it. All right, so we're going to go ahead and unpack it. If you hadn't got your answer in there, go ahead and slide it in there, okay? All right, so we're going to go ahead and talk about this thing, and most all of you got there, and if you just missed it, no worries. Like I said, we're just really just shining it up and making it spot on and making it shine like new for you. Okay, so whenever I see any of you just missed it, I know it's just a matter of just pointing little things out for you because you guys have solid coding skills. So I want you guys to be clear about that. Whenever you miss anything, it's just a matter of fine tuning some stuff. That's it. All right. So we've got these scoliosis measurements, and they are standing anteroposterior and lateral views is what they're getting of the entire thoracic and lumbar spine. Okay. So how are we going to report this, and how do we get to see? Well, we have 72040. This is radiologic examination spine cervical. We already know that's out. It's already told us we need the entire thoracic and lumbar spine. So we're going to take that one off. That lead code is incorrect. We're not even going to go any further. 72081. All right. I love this because this is a code family. So let's take a look. We've got this common code language, radiologic examination. That's good. Spine, entire spine and thoracic lumbar, including skull, cervical, sacral spine, if performed. So we know we're in the right spot. Yeah, there we go. That's just what we need. Now, the 72081, that's not what we're looking at anyway. This is specific to that code. That's why I have that. I'm always just reminding you guys there that everything before this semicolon is what applies. So we start looking 72082, that's for 2 or 3 views. Well, yeah, that's what we've got. We've got 2 views. We've got anterior, posterior, and lateral. All right. So we take a look here, 72083. We've got to do our due diligence. This is for 4 or 5 views. We know, nope, that's not it. And 72084, minimum of 6 views. Nope, that's not it either. See, I knew that. I knew that, Miss Natalie. So there we go. 72082. Yeah, we've got 2 views. Yeah, anterior, posterior, and lateral. That's it. So that's your code. All right, coders. Yeah. All right. So we're gonna keep it going. All right. Now you know I was gonna do it to you. Everybody get your bibs out because you gotta dig in. This is a steak meal. All right, so here we go. A 71046 with a 26 modifier, 74150 with a 26 modifier. B 71046, 74150. C 71046 with a 26 modifier, 74150. And finally D 71046 and 74150 with a 26 modifier. A 41-year-old male is in his doctor's office for a follow-up of an abnormality which was noted on an abdominal CT scan. He also had a chest x-ray, PA and lateral views performed in the office due to chest tightness. He states he otherwise feels well and is here to go over the results of his chest x-ray performed in the office and the CT scan performed at the diagnostic center. The results of the chest x-ray were normal. CT scan was sent to the office and the physician interpreted and documented that the CT scan of the abdomen showed a small mass in his right upper quadrant. What CPT codes are reported for the doctor's radiological services? All right. Okay, coders, you've got 2.5 minutes. All right. Just take a breath and code. You can do this. Your time, it starts now. How you doing, coders? That's time. Go ahead and slide your answer in there if it's not in there just yet. All right. All right. I think I have heard from everybody. All right. So we had a bit of a split and a mix, okay? And that's okay. So I'm gonna give you the pivotal key so that you will be spot on with anything that you see like this. All right. So you know I always have to throw something in there. Is not to trip you up. It's to be sure that if you have a weakness in something, that we're going to make it your strength. All right. So I'm going to show you what is pivotal to know so that you arrive at the right answer with these types of questions. I'm coming with it. I'm coming with it, Mr. Dodd. I'm coming with it. All right. So we've got this 41-year-old male. They're in this doctor's office, and they've had this chest x-ray, PA and lateral views that were performed in the office, okay? They've also had a CT scan that was performed at the diagnostic center. The physician is going to interpret and document this, and they have. They've noted a small mass in that right upper quadrant. Your answer is D. Okay. All right. So here we go. All right. So 26, that's for the professional component, and that pays for the doctor's services, and TC is for the technical component. Okay. But for this one, all right. So 26, professional component. All right. So how do we use these things in context with a scenario? All right. That's right, Miss Natalie. So here we go. Really, the question wasn't the codes were both the same, but it was a matter of knowing which code was what and what you needed for the code as far as the modifier, or if you needed one at all right. So this one here, 71045. Okay, radiologic examination chest. This is the two views. Okay, again, this is the sticking point. These codes, this is these modifiers. All right, so we know we've got the two views. We've got the PA and lateral. We know that's our code. All right, but what is this? So we know obviously that's the CT. Okay, so if that's not what we're coding for, what are we? When do we use the modifiers? Well, if it's a 26, this is when medical professionals read the radiologic report at the hospital, but it's not employed by the hospital. Then we're going to use 26. I told you that before. But if the hospital owns the equipment and the medical professional is employed by the hospital, say the doctor, then they're part of the global package. So then you wouldn't use the 26. All right. Also, when a patient goes to the office, it's assumed that the office owns the equipment. The provider at the practice reads the x-ray and provides the report, but the office bills for the global package. No modifier 26 is appended because that physician owns the equipment. It's their practice. They're, they are part of that global package in that scenario. If the procedure is performed at a surgical center, indicating not a hospital, and the provider isn't employed by the facility and read the report, you're going to need the 26 modifier as a professional service, as that provider doesn't own the equipment. So it's always a matter of, does the employee or the person who's reading it, do they work there? Do they work there? Is that equipment owned by that, not only owned by the facility, but does the person work there? Okay, that's the key. Do they work there? All right. So the x-ray was performed in the doctor's office. So would you need the 26 modifier? See, now I want to hear from you, because now that you got that little piece, do you need the modifier now that you know they're at the doctor's office? Okay. And so the doctor's office, they've done the x-ray there, but would you need it? Yeah, see, yep, you wouldn't need it. So every place that you see that 26 modifier, you take it away. So now the only thing we have left now is to determine, do we need a modifier on this CT scan? Now, based on what you know, the CT scan was performed at the diagnostic center. Now, mind you, this result was sent over to the doctor's office now, and it's telling you if the physician interpreted it and documented it, then what do we need then? See, now we're coding for his what? Professional services. So there we need it. The physician's only interpreting the CT scan. All right. That's how we got to D. Okay. How you feeling, coders? All right, so I'm going to make sure you understand these modifiers for the scenario. Can you eliminate one of them on site? Well, once we see that performed in the office, and we know the chest x-ray is global, we could do that. We know we're going to need a modifier on one of them. We're not sure because we've got to determine which is which. So once we knew this is the x-ray, this is the CT scan, we could go to work, okay? So there, chest x-ray, that's the global code. So everywhere that was, we took that away. And then the physician is just interpreting the CT scan. All right. So that took that away. So really, once you looked up these codes and you knew which was which, then it was a matter of just connecting the dots. Okay. Yeah, so if you need to go back over it, then that's fine. I'm glad, Soma. So does anybody need a screenshot on either of these before we move on? Do you need, or have you guys gotten your screenshot, or everybody good? All right, before I move on. I think everybody's good. Okay, yeah, this is like one of the ones I say sometimes you gotta let that thing simmer, but once you get it, you got it. All right. Now this one right here is gonna be like cake. This is cake after that one, right? So we've got A 77080, B 77081, C 77078, and finally D 77077. The physician requests a dual energy absorptometry of the foot. Which code should be reported for this diagnostic test? All right, coders, you got, I'm going to say probably 2 minutes, but I'll give you 2.5. Your time, it starts now. All right, I think I have heard from everybody. Let me count real quick. Yeah, I've gotten all of you guys in there. Hey, you guys are just doing it today, and I like to see you guys picking up some time and speed on these types of questions. So that'll give you time for some of the others that require just a wee bit more thought. All right. So yeah, dual energy absorptometry of the foot. You guys know which test to report. It's answer B, 77081. It's simply going through and reading correctly. 77077. This is a joint survey, single view. Nah. We're just matching up our key terms there. Computed tomography or CT, bone mineral density. Nope, no keywords there. Dual energy X-ray, optometry, DXA. Yeah, I like that. Yeah, right there. I love it. Yeah, and we get here. Yeah, this is no good. This common code language there, but that the specific code language. I'm sorry, the common code language is spot on, but everything afterwards, no. So we're going to take that one off, and it's just a matter of getting down here. Yeah, we need this appendicular skeleton, radius, wrist, heel. Yeah, that sounds like a foot to me. Yeah, 77081. And this here, that doesn't apply. So that's your code. All right. Yeah, the appendicular skeleton. Always remember appendicular. Those are your appendages, your arms, your legs, all that good stuff. All right. So you guys were spot on. Great keywords in the chat. And you guys are doing it today. I'm loving what I see. I see you in there, Miss Natalie, doing it. You too, Rasha, Renata, Sonia, Sharnita, Soma, Susie. You guys are putting in the work and it shows. I love it. We're gonna go ahead and do another. All right, so we've got A 76818, B 76819, C 76815, and finally D 59025 and 76818. A 25-year-old female in her last trimester of pregnancy comes into her obstetrician's office for a fetal biophysical profile, or BPP. An ultrasound is used to first monitor the fetus movements, showing 3 movements of the legs and arms normal. There are 2 breathing movements lasting 30 seconds, normal. Non-stress test, NST, of 30 minutes showed the heartbeat at 120 beats per minute that increased with movement, normal or reactive. Arms and legs were flexed with fetus head in its chest, opening and closing of a hand. 2 pockets of amniotic fluid at 3 cc's were seen in the uterine cavity, normal. Biophysical profile scored 9 out of 10 points, normal or reassuring. What CPT code is reported by the obstetrician? All right, coders, 2.5 minutes. You got this. All right, get your knives and forks out. You guys, you're ready. Your time starts now. All right, coders, that's our time. And I think I have heard from most of you in that chat. Now, let's see here. Let me do my little count. Let me count. I feel like mamas when they're out and all the kids are out with them. I got to do a head count. Okay. You guys are doing some fantastic work in there. I'm liking what I see. And most of you got there. And if you didn't get there, all you're going to need is a little nudge. Okay. So, hey, I love it. You guys are just bringing the heat today. Bringing the heat. Okay. I know. You know what? And a couple of you were torn between A and D. And I saw several of you say that. All right. And so, yeah, that is the answer. It is A. All right. So we've got that 25-year-old. They're in their last trimester of pregnancy, and they're in the obstetrician's office for this BPP, and this ultrasound is monitoring the fetus's movements. And we have this non-stress test and this biophysical profile, and we need to figure out what do we need to report. Okay. All right. So the answer is A. And for those of you who were torn between A and D, I'm going to give you what you need so you can break the tie when you're on your own. All right. So I won't be there to say, hey, let me just nudge you a little bit. All right. So here we go. We've got 76815, and this is for ultrasound, pregnant uterus, real-time imaging. It's limited. Okay. Be sure you have this part of your really all of your manual, Chun, but having it, Chun, will help you too. That's limited, so we would take 76815 off. Okay. I won't be there when you test, Miss Renata. But I guess you'll hear me in all my shenanigans though when you do certain things, especially when you're able to eliminate like two right off the bat. You hear me saying 2 for 1. So then we have 76818. This is for that fetal biophysical profile with non-stress testing. Yeah, that looks pretty good there. That's for that BPP, and we see that over there. All right, so we're gonna say, yeah, I like that with non-stress testing. That's good stuff right there. We're gonna give that a like. Yes, we've got a bit more work to do. 76819, we know that one's without non-stress testing. We had stress testing, so 76819 is no good. Now, everybody got to that, and some of you were teetering between these two. 59025. This is for a fetal non-stress test. Well, tell me, what does 76818 report? Okay. 76818, that has a stress test. We wouldn't report this separately because it's included in that. Remember, when you have a procedure, anything that is inclusive in your code language, then you don't have to report it separately. Yeah, so we would take that off the table. We've already accounted for the fetal non-stress test. It's part of the code language here with 76818. And then here are our parenthetical guidelines. Okay. But this is what we needed just right there, 76818. Okay. So we were right where we needed to be. Parenthetical guidelines, good to know what we need, but none of the things that were listed here applied. So we're good. All right. All right. So let's see. We've got 15 more minutes. So give me 1 second and let me pull out something else. Okay. Sounds back, Miss Sharnita. Okay, good. All right. If anybody needs a screenshot, you can grab it. But just remember, when something is inclusive in your code language and they're giving you a code for a procedure that you've already coded for, don't take the bait. Okay. All righty. Miss Nellie said it's gonna be the three of us taking the test. It's gonna be me, her, and Mrs. J. Okay, I heard Mrs. J when I was taking that test too. I tell you, I would just hear her, and if nothing else, hear her saying every time, you know, you got something right. Outstanding. That'll keep you going. All right. So let me pull up yet another one here, and yeah, we've got time to do this one. We're gonna go back into some other coding that I had. All right, so we're gonna go ahead and start with A 00932, B 00934, and C 00936, followed by D 00938. What is the anesthesia code for a complete removal of the penis, including removal of both the left and right inguinal and iliac lymph nodes? All right, coders, I'm going to give you 2.5 minutes, but I think you could probably do it in two. But hey, show me what you got, coders. Your time starts now. All right, coders, you guys have gotten those codes in there. Y'all are flexing. Y'all are flexing. My youngest daughter loves working out, and she'll come in here flexing and say, Mom, look. So, hey, you guys are flexing today. So, hey, here we go. Yeah, you all got there. It is indeed C. So, we're going to unpack it real quick. We're talking about complete removal of the penis, okay? And they are removing both the left and right inguinal and iliac nodes. You guys knew exactly where to look. Yeah, we're just taking a look simply at this code family. All right. And I got a sneaky suspicion you guys have got things chunned. All right. So, here we go. We've got anesthesia for procedures on male genitalia, including open urethral procedures. Yeah, we're right where we need to be. Okay, so we're just going to tick them off. 00932, that's for complete amputation. Okay, well, doesn't code for the lymphadenectomy. Okay, so we got to keep going. Radical amputation of penis with bilateral inguinal lymphadenectomy. We have inguinal and iliac lymph nodes. We're close, but not quite there with that one. We're missing that iliac lymphadenectomy. All right. And here we get down here to 00936, radical amputation of penis with bilateral inguinal and iliac lymphadenectomy. Yeah, that's a light. Yes, I can't imagine anything's going to be better than that, but we've got to do it. 00938, insertion of penile prostate. No. Now we're taking stuff off. They're talking about putting things on. Yeah, that one right there, wrong procedure. And yeah, you guys got there. Yeah, that's right. We're not a chun and done. All right, chun and done. All right, so I'm gonna pause my screen and I've got another one I can pull up. We've still got about 10 good minutes. And hey, I like to use every morsel of time. I told y'all I keep plenty of junk in the trunk. All right, so here we go. A20526, B00400, C01820, and finally D01810. What is the appropriate code for a patient who had a regional block anesthesia provided for carpal tunnel surgery? All right, coders, you got 2.5 minutes. And from what I've been seeing today, this is going to be no problem. All right, knock it out the park, guys. Here we go. All right, coders. I think I've gotten everybody's answers in there. Yeah. I'm loving what I'm seeing, okay? If you almost got there, not quite, we're going to get you there, okay? All right, so our answer is D. Yeah, it is. It sure is. All right, so what do? We have this regional block anesthesia for this carpal tunnel surgery. All right, so use in any section of your book, use your headers too to be sure you're in the right spot. So we have note in this scenario, we are coding for what? Anesthesia. Okay, so because we're coding for anesthesia, we could go ahead and get rid of 20526 because that's a surgical code. So right off the bat, we know we don't need that one. So we're going to focus our attention on these others here. Well, 00400, no one took the bait on that. You guys already know we're in the wrong location. This is for the thorax. Okay, so we're going to take that one off. All right. So we're going to keep on going. This is where we need to be. We have 01810. This is for anesthesia for all procedures or nerves, muscles, tendons, the forearm, wrist, and hand. All right. So carpal tunnel surgery refers to the median nerve in the wrist. All right. So we're going to give it a light yes and then continue on and take a closer look at 01820. Anesthesia for all closed procedures on the radius ulna, wrist or hand bones. Okay, so that was the sticking point there. Okay, wrong procedure there. We're coding for anesthesia for the bones that go into that area of the hand, but we are talking about the median nerve with carpal tunnel. All right, so I think you guys are ready to test. And if you feel like you're not quite there, I would say all you need to do at this point is just kind of shine off some things and continue to practice until you feel confident that you are ready to do it. Okay, because I feel like you guys are just phenomenal. Okay, you guys have blown it out the water. All right, so yeah, leave me your feedback. It has been my pleasure to hang out with you guys. It is my goal, my sincere desire to help you guys to get there to your certification goals. AMCI, we want to continue to help you guys and to deliver quality classes. You guys are family, okay? So yeah, no feedback means no good. Yeah, so yeah, leave us some comments.